Hello everybody, this is James, and in this video I have made a medical mnemonic to help you memorize the topic, causes and types of lower urinary tract symptoms. This refers to a range of non-specific symptoms that affects the urinary system. First, let's take a look at the medical mnemonic that describes the causes of LUTS. Now, some basic physiology. Micturition, also known as urination, involves several neural pathways that coordinates the action of several muscles. It consists of two phases, the storage and the voiding phase. During the storage phase, the bladder fills and the internal urethral sphincter contracts to maintain continence of urine. During the voiding phase, the detrusor muscle contracts whilst the external urethral sphincter relaxes. Now let's take a look at the level of T11 to L2 right here. We have the sympathetic nerve called hypogastric nerve that comes out of the sympathetic trunk, and it activates beta-3 adrenal receptors through the neurotransmitter norepinephrine. When norepinephrine activates these receptors, there is going to be a relaxation of the detrusor. Now the same hypogastric nerve goes in to activate the alpha-1 adrenal receptors through norepinephrine. And again, that effect will lead to constriction of the internal urethral sphincter. And we will have that leading to a detrusor relaxation as well as an internal urethral sphincter constriction, and that helps storage. Pudendal nerve, which comes from S2, S4, also activates the nicotinic receptors on the external urethral sphincter through acetylcholine. And so during the storage phase, it is the sympathetic nervous system that predominates. On the other hand, it is the parasympathetic nervous system that predominates in the voiding phase. So we have parasympathetic nerves through the pelvic ganglion. The pelvic nerve activates M3 muscarinic receptors through the neurotransmitter acetylcholine. The effect is going to be a detrusor contraction as well as the internal urethral sphincter, and the external urethral sphincter relaxes as a result of inhibition of the sympathetic nervous system. So a recap of the causes of lower urinary tract symptoms: urolithiasis, infections, tumors, structural abnormalities such as a bladder diverticle, foreign bodies, and outlet obstruction of the bladder, benign prostatic hyperplasia, prostate cancer, and urethral strictures may actually obstruct the bladder outlet and lead to lower urinary tract symptoms. And it's very important to note that these signs and symptoms of LUTS is very common in the elderly population that suffers benign prostatic hyperplasia. Chronic pelvic pain syndrome, as well as problems with the nerves, may also be associated with LUTS. Now, regarding the innervation, it's important to understand that for adequate balance between bladder storage and emptying, the muscles and the nerves must work together. So if there is any impairment of bladder function due to, say, a brain or a spinal cord or a nerve disorder, for example, multiple sclerosis, stroke, Parkinson's disease, or any spinal cord abnormalities, can actually lead to lower urinary tract symptoms. So here we have the irritative lower urinary tract symptoms, and they usually occur as a result of inflammation of the lower urinary tract tissues, detrusor overactivity, smooth muscle tone alterations, and a heightened sensitivity of receptors, frequency, and abnormal frequent urination. So how many times should you void in a day? I think the answer will depend on how much fluids you consume in a day, but normally anything around 6 to 7 per 24 hours would be okay. Moreover, the normal bladder capacity ranges from somewhere around 350 to 400 mils. Okay, this is how much your bladder can take optimally. But the bladder can actually stretch to contain as much as 600 sometimes if there need be. So the bladder is very, very compliant. And so it's important to understand that if the bladder gets too filled, then there's going to be a detrusor contraction that will lead to the voiding phase. Now, urgency is the inability to postpone urination. Nocturia is where one gets up on a regular basis to void at night. It is not, getting up occasionally once to void, but where one gets up on a regular basis to void, we'll call that nocturia. And it's important to remember that the production of urine at night should be less than 1/3 of the total daily urine output. Dysuria is a painful urination. Obstructive lower urinary tract symptoms. A great example of a disorder that causes these symptoms is a benign prostatic hyperplasia, straining to void, hesitancy, which is a difficulty initiating the stream or to keep it flowing. Intermittency of the stream is the inability to maintain a continuous flow of the stream. In other words, there is a stop and the start of the flow. Retention of urine is the inability to voluntarily pass urine, and it can be acute or chronic, very painful, and it is a urological emergency. So normally the residual volume of urine should be less than 50 mils. In fact, anything between 50 to 100 mils may be considered okay in the elderly, but anything beyond 100 mils is a sign of retention of urine. Terminal dribbling is a dribbling or leakage of urine after voiding is complete. And the stream which is encountered is very, very sluggish, very weak, slow urinary stream. I hope this was useful. Thank you very much.